ahead and shut that curtain for privacy. My name's Sabrina. I'll be your student nurse today. Can you please state your name and date of birth for me? Awesome. Let me check your wristband. Good. Do you have any allergies I need to be aware of? Are you in any pain at all?
30 milliliters.
Okay. So today I'm going to be doing a nasopharyngeal and oropharyngeal suctioning on you just to get the mucus and secretions out of your airway that you are not able to get out yourself. Before that, I am going to provide some supplemental oxygen for you. That way you can breathe and feel normal when you're breathing, and just to make sure that your oxygen doesn't go down below 93. So first, what I'm going to do is place this pulse ox on you to monitor your oxygen saturation level. And at this time, I would also do an integrated head-to-toe assessment and a focused respiratory assessment, listening to your lungs, watching oxygen saturation, everything like that. But in the case of this video, we don't have to do that since we were the first clinical group. So I was just going to state that for you to let you know. And so then next I would administer supplemental oxygen. So this would be packaged. So I would take it out of the package, turn the oxygen on, make sure it works. I'm going to turn it on to about 4 liters per minute. So I'm going to put it in the patient's nose and behind his head. Just going to make sure it's not too snug and comfortable, but it's not too loose. And now that that's done, I'm going to put on some gloves, and I will check the suctioning to make sure the suctioning is working properly. And before this, I would check to make sure the order is there for the nasopharyngeal suctioning, and then I would also check to make sure there was no medication for pain that was ordered before this as well. In this case, there's no pain medication that was ordered, and the suctioning order was there.
And then down to the side was the process.
Take the suctioning.
And then I'm going to keep in mind that was about 45. And so next I can go ahead and
It cannot go above 150 for adults, so I'm going to check and make sure that it doesn't.
making sure to pour off the
So that does not go over 150 millimeters mercury. I'm going to put this in a accessible place.
alcohol-based lubricant.
And this whole time I will be checking the oxygen saturation to make sure it does not go below 93%. So what I'm going to do next is I'm going to place a moisture pad down so the patient does not get anything on his clothes or on his bed sheets. I'm also going to put a basin near him in case he needs to spit up anything like mucus or if he throws up or anything like that. So at this time I would perform hand hygiene, and I would get ready for an aseptic technique. I would put on a gown and gloves, and I put on a gown and a face mask just to make sure you don't get anything splashed on you. And I would also put on sterile gloves. But before I do that, I'm going to set up my sterile procedure. So I'm going to open the sterile tray. I'm going to push these gloves out, and we're going to go ahead and start with abdominal.
Just so rough secure for now. And now I would have my patients have the location of the tube checked to make sure that it's in the stomach.
I can't get that out, so I'm going to actually do that after I
For video purposes, we're going to
put on
X-ray came back good. And then another way that we want to check it, because you do want to check it for the delay, I would compare it
throw those away. So what I would do next is I would look at the sterile saline, make sure it's the patient's name and that the expiration date is not passed. So if everything is okay on that, I would pour it into the sterile tray,
just to make sure that
and I would keep it cap side up. Then next I would take the lubricating jelly and I would pour it onto the sterile tray,
acidity of the stomach is less than
making sure that the package doesn't touch it.
so then we know that it's in the right position.
And then I'm going to go ahead and put on sterile gloves, checking to make sure the patient is still okay, oxygen saturation level, that the patient isn't having any trouble breathing.
Okay, clamp the tube again. And also, since that placement was correct, I could put down a more permanent tape, but for video purposes, I'm just going to state that. And then I'm going to go ahead and I would have a new tube. Remove the syringe.
Lower this to at least 30 degrees.
I'm going to pre-measure out my bolus, and that way 75 milliliters that were ordered.
Okay,
So I would have that ready.
put on my sterile gloves.
And then I can go ahead and put my tube back on. I will pour the bolus into the tube.
Okay.
Yeah,
I would put on my other sterile glove.
I think clamp it and then, which is weird, but just try. Just,
Making sure not to have my sterile glove touch the cup.
I think, yeah.
Okay, so now that they're on, I can fix them.
Then you can just, once you put the tube back on,
Take it from behind so you don't touch anything. Over
so after my tube is on,
this.
I can go ahead and clamp
Okay, so now that I'm sterile,
then administer
throw this away.
75 milliliters of bolus.
So I'm going to come back around.
And once that's in there, I can unclamp my tube.
And you
then
cannot
while
touch the
feeding
curtain.
is administered, I can higher
So
or lower, depending on the patient's
next
tolerance
I am
and how
going
fast I
to
want the
pick
feeder
up
to go. So I give that enough time, and then once
catheter.
it's reaching, the feeding is reaching the bottom, I would administer 30 to 60 milliliters of water into the syringe to flush out the tube.
So I am going to connect the catheter to the suction. Now this hand is clean, so I cannot touch the catheter with it.
Then I would place a cap over the end of
Then
this,
I
but
would-
we don't have caps, so I would also
First,
have
I
this
would
into my
check to make
patient's
sure
mouth,
that
just in a comfortable position so that they could move their head
it's
around.
working.
And then I would just leave this down.
And then I would
make sure that my patient is okay. I could perform another abdominal assessment.
apply
to make sure their
lubricant
abdominal
on it,
size
2 to 3 inches.
And then
Before I start, I would check and measure how far it needs to go in to the patient's nose. It's normally about 5 to 6 inches. I'm going to measure it by putting it at the ear to the side of the nose. Okay. So I know how far it needs to go in. And then normally you would have someone take out the oxygen and so you can perform the procedure. So in this case I'm going to have the recorder do it. Thank you. So I'm going to ask the patient to take a few deep breaths. Continue to watch his oxygen saturation level, and I'll start to slowly
for at least 30 minutes after the feeding, just to prevent
it in.
aspiration risk. And so I would ask the patient if they needed anything else.
Making sure not to suction while
Hand hygiene. And I would go charge.
you're putting it in. So now that it's in, I'm going to start suctioning.
You didn't measure how long this lasted now.
Okay.
Okay. So you can't suction for more than 15 to 30 seconds, 10 to 15 seconds, sorry. And then you have to irrigate after. and you have to wait 30 seconds to a minute before you suction again. So then at this time, I would have the other nurse move the oxygen back over, but move it to where I can get into the other nasal area so I can do both sides. Okay, so after a minute, you would start again.
And I would just document how many centimeters of the tube were coming out.
Put it about
I think that's it. And then we forgot.
5 to 6 inches, and then you would start.
I would check
And then the other nurse would put the oxygen back on. Then you would irrigate it again. Checking oxygen saturation level, making sure it's not going below 93, like I said, and then you would wait a minute, and lastly, if they need it, you would do the oro, and you would measure this by the mouth to the jawline, which is normally about 3 to 4 inches. So after that, you ask the patient to take a few deep breaths, and you're going to slide it slowly into the back, and then suction. Okay, I'm going to irrigate that back out. And after that, you can take the catheter out. You can take these off. Like this. Check and make sure the patient is okay. Now that you're done with this, you can throw all your sterile stuff away. You would also need to perform oral hygiene on the patient after you did the suctioning, and then you would do another focused respiratory assessment, check his lung sounds, his oxygen saturation, his effort, everything like that, and just to make sure that the suctioning did not cause his oxygen level to go down too low. And then at the very end, you would lift the patient, or put the patient down to the lowest possible position, because he was in a semi-Fowler's position and he was up at a comfortable working height. And then you would ask the patient if he needed anything else, and if he didn't, then you're good to go.